Wild stuff. Hello and good afternoon to our 50 plus and fabulous Facebook group. We're so excited to be here today on another Money Monday. And today we have JoAnne with us to talk about Medicare. And she tells us that we do not need to be worried. There's nothing to worry about with Medicare. It's very simple. So we're excited to have you here. Where are you coming in from today, JoAnne?
I'm in Michigan.
Michigan. And how's the weather there?
It's not, the sun's not shining here either.
Oh, nice.
Rest assured.
Okay, cool.
Rest assured, right.
Cool. I'm not missing out on anything.
You're not missing out at all.
And how long have you been in Medicare now?
For 100% Medicare, solid 5 years. So we have 8 agents that just do 100% Medicare. So it's been a long 5 years. Yeah. Yeah. So we can kind of make it simple. It's not simple, but we can make it simple.
Perfect.
And talking to somebody like you, who your age, I mean, your gobs away from Medicare. So it's even funny even to have a young person like you talking about Medicare. So it's kind of cool that you're exposing all this stuff.
Yeah. I mean, this group is definitely,
right.
It's a 50 plus group. Yeah. But, I know it is kind of ironic that I'm hosting this one, but it happens.
Yeah. You can explain what happened to your mom, that she disappeared.
Yeah, I'm going to jump in here. There's a ton of drilling going on the balcony in my apartment building. So it stopped for a few seconds. So you won't see a lot of me because you won't hear me, but I wanted to say hello and welcome. And thank you for being here. We're glad JoAnne's here. She's a great first strings approved professional expert on all things Medicare. And yeah, she did say when Max and I were talking to her, she said people are always afraid of Medicare and they think it's confusing, but she's going to make it very simple and easy for us. So I hope that you'll shout out your questions at any point in time, and Maggie will facilitate those and make sure they get answered by JoAnne. So just wanted to welcome you to our Purse Strings event. Purse Strings always provides free online tools and resources to help women make smart financial decisions. Our tools and resources are free, and we also have this list of Purse Strings approved professionals. And I'm out.
Oh, that's classic. That's classic.
And she's back to the drilling.
She's back to the drilling. That's so funny. So yeah, so we do make Medicare, I think, less stressful for people because we know how stressful it really is. It's a crazy system. This is kind of one of my classic PowerPoints. I'm just going to rifle through. I don't want to take gobs of time today, but like Barb said, if you guys have questions, feel free to type them in. Maggie will stop me, pause me. I do talk fast. Sorry. It's the Italian in me that I just kind of get going with this stuff. And there's a lot of content. So just kind of beware. If you need any questions after I think our contact stuff is on the Purse String site. You can go over there. But we really, at the end of the day, do try and make it a lot easier. But I clarify too, we're an insurance agency. A lot of people don't seem to understand that because we do a lot of I would say coaching, consulting. We do help with, the government services, with Social Security, getting people enrolled that way. So a lot of people sometimes think we work for the government, and we don't. So we are an insurance agency. So we help people with the products that they need to buy that goes along with their Medicare. But because Medicare is a government program, you need both parts. So we do a lot of the coaching for no charge effectively, but we're paid by insurance companies. So we just always try to clear that out. But Medicare is confusing, and that if anyone is turning 65, this might be a younger group. I know it's 50 plus, but you might have, a spouse that's, 64, 65. This is what happens. And this industry is, I will say, it's not very pretty sometimes. It's really salesy. It's really, really salesy. So that's what gets frustrating is people get really solicited, really hammered with bad material, things like that. They read the wrong things. They go to the websites. This was a piece, and I can't get too detailed again, lack of time today, but this was a Costco magazine article, and this was actually wrong information in the upper right. So I use this on all my slides, and I try and tell people, like, you're reading the Costco Connection magazine, which, and granted, it's not like a government publication, but you kind of expect, the material in there to be, hopefully right or close to right, but this was absolutely wrong. That piece up there just said that if you don't enroll into Medicare when you're eligible, which means age 65 for the most part, you will get, and it says if you postpone it, you will get a late enrollment penalty. Well, that's completely not true. So you got to be really careful, and it's tough. You got friends telling you what to do. You've got siblings saying, well, I did this, and they, you think they might know what they did. They made mistakes too sometimes, and they're passing along mistakes to you. So it gets that's the stressful, really confusing part to Medicare. After you get through that stuff, it's actually, I hate to say easy, but it can be a lot easier. So what we focus on is the whole transitioning to that Medicare space for the very first time. So that means if someone calls us just today, we got a phone call from someone in Ohio. Hey, I am losing my employer coverage. I need coverage with Medicare June 1st. Well, in her case, she needs to go back and she needs to add Part B in Medicare, and we need to get her her products and stuff like that. But that's a transition situation. So is turning 65. Hey, I'm turning 65 in September, so I don't know what to do. That's a transition to the Medicare system. That's our best casework, if you will. We're not really good if you have a 93-year-old mother and their premiums are $400 a month right now. There's not much you can do to improve the situation for the 91-year-old. So it's challenging. So we like to kind of help people get there in the right way so you don't make mistakes. Our whole philosophy is just get it done right in the beginning, or understand so you don't screw it up, basically. So we spend lots of time with these kind of things. What is Medicare? And this is just a sample of how we work with people. What is it? We describe it. Do you need it? That's always a big question, because not everybody needs it at 65 or 70 or whatever their age is. They don't always need it. And that's really, really misunderstood. Everyone thinks, oh my God, you got to go get it at 65. And if you don't, these lightning bolts are going to come out of the sky. And none of that happens. Okay. So then if you do need it, how do you go get it? How much is it going to cost you? What's it going to cover? Can I keep my doctors? These are all the really, really, really common things that we go through. And then our goal for you is at the end, go relax. You picked wisely, you're done. So we talk about these types of things all the time, all day, every day. Medicare Advantage, Medigap, pre-existing conditions. Pre-existing conditions do occur in the Medicare space. A lot of people don't understand that. We talk about COBRA a lot these days because of people with layoffs, COVID was a big inducer of furloughs and layoffs and all sorts of things. And just even anxiety. A lot of people just retired because of the challenges in the workspace. But there's a big process to Medicare. It's not typically just a one phone call and 20 minutes later you're done. There's some steps. You have to go through all of this. So you have to go to the government. The government administers Medicare. So it is designed to be used in the United States. It's designed for people age 65. Now, this is interesting lately, too. There's a lot of talk of this going down to age 60. So that gets closer to this band in this group. Does that capture? It's supposed to capture like 22 million more people that are eligible, which is actually pretty interesting. What can happen with that? I tend to think this time it might be for real. We'll see what happens in the coming months. But at this point, age 65 and older, you're eligible for Medicare. Or if you're disabled, I've got a 27-year-old on disability with Medicare. Or if you have end-stage renal or ALS, those are two medical conditions where people get fast-tracked. So there's Part A and there's Part B. These are just the two components to Medicare. I'm not going to get a lot into these, but there's a premium for Part B. So what happens is people will shift to, if they need Medicare, they will pay the government, right? They're not going to pay Blue Cross anymore. They're going to pay the government. So there's a premium. So a lot of people don't understand, number one, that there's a premium, and some people don't understand how costly the premiums actually can be. And that's going to go based on income. And I'll show you that in a second. The other key part that people don't seem to understand sometimes is that these two parts together, they're only going to cover 80% of your health care. They're not designed to do 100% of your health care, just 80%. So a lot of things Medicare doesn't even cover. And this makes people really uptight, especially lack of dental coverage. That's a big, big area that people spend a lot of money on. So if you're in your 50s, honest to God, just save up for your dental, root canals, implants, things like that. Those can be really costly, and Medicare doesn't cover those at this point. Same with vision eye exams. That's just basic eye exams, like Costco, getting new lenses, things like that. Doesn't cover hearing aids, doesn't cover gym memberships, doesn't cover drugs. It's a separate plan. We always poke fun too about where people go for advice. They definitely go to their friends. If you ask the Social Security Administration for advice on Medicare, that's really not a good thing to do. They are not Medicare. All right. So that's something just significant to understand. They are Social Security. They are there for us to file you with Medicare. That's how you get to Medicare, is through the Social Security Administration. They bill you, but they are not the Medicare division. There's a whole other section for that. So that's what's really kind of dumb and confusing, right? It's like, why does Social Security do Medicare? And then you can't call Social Security to ask a question. If you do, you usually get a wrong answer. So be really careful there. A lot of people go to their doctor. Don't do that. It's a poor place to get information. Doctors don't know Medicare. We have lots of doctors that make lots of mistakes, and that's okay because they're doctors, right? They're not insurance people. And then oftentimes, you know, your financial CPA, your HR person, things like that, we pair up with tons of those folks so that we can be that Medicare department, if you will, because they don't have time to spend 12, 13-hour days like we do in the Medicare space. So you just got to kind of collect information and take some of it with a grain of salt. And then honestly, sit down at that point and find a good agent and walk through all your questions, because you're going to come up with dozens and dozens of questions potentially with all of this stuff. So we go through all the situations, you know, are you eligible for coverage? You know, do you have COBRA? Blah, blah, blah. There's all different, these are just, you know, 5 of our most common scenarios. But that's the, I would say this is the, I don't know what you call it, the finessing part to Medicare, I guess, is just trying to listen to people. You know, what are they looking for? What do they need? What are they eligible for? Right? Because what if they have coverage? I had somebody recently that he was, you know, eligible for TRICARE for Life, which is phenomenal insurance through the military. He had no idea that he actually he was already enrolled in it since December, you know? So it's just our ears are tuned to all these situations. You know, are you in a small employer plan? Do you have COBRA? When we hear some of these things, that's when we say, okay, now we got to talk about that. Let's drill into this piece over here. So it's that's where it's a lot of consulting-ish kind of thing. And I think that's where we get confused. But at the end of the day, you know, I just think we're just good agents that are listening to what we're trying to navigate. So when you go through all this stuff, you know, some people come out of this little funnel and, you know, we say, well, okay, you need Medicare, or it might be, I don't need Medicare. You don't need this. So we have lots of people, we might say like, you know, you don't need us now. You know, you need us in 3 or 4 years when you're going to retire. All right. Remember that everybody does not have to enroll into the Medicare system. And again, that's super mythical, and everybody thinks that you do have to enroll. So when you talk about cost, this part always surprises people. So I'll give you like the chart that we use for people. And I will tell you, everybody we ask, you know, hey, okay, now that we know you need Part B, has anybody discussed with you how much it's going to cost?
Hey, JoAnne, can I jump in here with you for a minute?
Sure.
And so does everyone need Part A and Part B?
No. So a good example of somebody that does not need Part B, but then may add Part A. Part A is generally free for people. So
okay.
If you've got somebody that's working for General Electric, let's say it's a big company, you've got good insurance at work, you're turning 65, you're not contributing to a health savings account. So see, these are some of the key questions. If that person does not, like I said, doesn't contribute to an HSA, hey, I love my group plan, you know, I pay $150 a month, I'm healthy, I think I'm going to work till I'm 68, 69 years old. That right there is exactly a person where we would just say, well, then get Part A only, file for the free stuff, let it coordinate with your group plan. And then when you don't have that GE coverage, when you retire in a few years, well, heck, come back. We'll tell you how to get it and we'll hook it up. We'll talk to you about how much it's going to cost you. And at that point, Part B is the replacement insurance.
Okay. So A is just kind of an additional.
Well, it's in lieu of, because at that point, the person doesn't have the GE insurance. He doesn't have anything, you know, and they don't have a retiree plan anymore. So it's like, well, I need insurance. So, okay, now you need Medicare. So that's where people get goofed up. So a lot of people might be working and they just take Part A and Part B because they think they have to, which is a bad reason to take it. And then they start paying these numbers on the right-hand side and they just aren't even seriously, just aren't paying attention. Right. So that's not what you want to be doing. At that point, you've got double insurance. And unless you're really ill, there's not a lot of reasons to have double insurance. So that's a really good question, though, because a lot of people, we call them the just because people, which is not good. Don't be a just because person. Because I met like a doctor not too long ago that he signed up 10 years ago for Part A and Part B both. And he's been paying, he's in the top level, that $504 a month. That's how much it's costing him because he makes a bunch of money. And I said, well, why did you get Part B 10 years ago? And he goes, because I thought I had to. So the guy's been paying $6,000 a year times 10 years, he doesn't need to pay, right? So just doesn't make sense. So people do that all the time. But this right here is just showing people too that Medicare looks at your income. They go back 2 years. And so you got to be careful, even working with your CPA or your financial person, that you're not, going over different levels, right? So every year there's a whole new layer of complexity here. But this is the cost on the right-hand side. And like I said, the base level is $148.50. The top tier is $504.90. And people are really surprised that it can get that high, and it can get that high. So, and it's just super interesting. You deal with high net worth people all the time, and they just are not prepared. A doctor the other day said, he goes, I am shocked that it's $504 a month per person. And then that's not it. So on this side, there's also these are just taxes. At the end of the day, we just call them a tax or a surcharge. But there's an additional surcharge on the drug plan side of things too. So that person that's, making over $750, they're also going to pay $77 a month just because they have high net worth. Okay. So fair, not fair, whatever. We hear it all the time, but it doesn't matter. This is what it is. So we spend our time, just kind of crafting out what they're going to pay. So then we, get people enrolled. We talk them through their windows. This is, everybody seems to know this window. This is 3 months before you turn 65 and 3 months after. That time zone right here, this 7 months is only for people when you're turning 65. So this is basically the turning 65-year-old gets one shot at Medicare, and it's over those 7 months. And basically it's, do you want it? If you do want it, come get it during those 7 months. And that's it. And that's how easy it is. If you're that GE person that's going to work till 68, 69 years old, ignore it. You can't ignore it. And nothing bad will happen if you don't even sign up for Part A. Then what's going to happen is you come back in a few years. You come and you say, hey, I'm going to retire in 2 months. At this point, I'm ready to go. I'm going to retire in October 1st. So we start working with that person probably in August 1st and just say, okay, we help them get their forms together and get their Medicare with the government hooked up. And what people do, and this is the penalty situation that people talk about all the time, and people get really, really hyped up over the penalty. The penalty doesn't happen as often as people would think it happens. It really doesn't happen very much, but when it happens, it's there. It's a 10%. There's a late enrollment penalty is what I'm referring to. Meaning if you don't have coverage in place, there is a late enrollment penalty if you don't go off and get Medicare. And that penalty can be 10% for every 12-month period of time that you don't have any coverage in place. And the bad thing to the penalty is it's not like a parking ticket where you can just kind of pay it and move on. This penalty stays for life, right? So you get penalized, you will carry that to the day you die. But again, most people don't deal with the penalty. Most people are coming out, in our case, most people are coming with out of the employer insurance, just calling us 2 months in advance and just saying, okay, now I need to get my Medicare squared away because I'm going to be retiring in a couple months. Okay. So we give them the right forms. They go back to Social Security. And what they do is they just verify with their employer that they've had coverage since they turned 65. So it's a pretty easy process. And then they literally get to pick when they want their start date to start. So again, it's just insurance coverage coming from the government. And I think just again, because the government administers this stuff, it makes people extra nervous, extra anxiety kind of flowing in because of that. But it's really, really not that super difficult. So we pair it up. We just pair it up to their other insurance ending. So we do this all the time. It's pretty flawless. Then this is where we really come in as agents, right? Because again, we talk them through, okay, here's how much it's going to cost. Now you go get your Medicare piece with the government. But that's not all, because again, go back to that 80% piece. So this is the part that's really critical. If I can get one thing across to you all, it's just to understand that Medicare, when you get to the point that, yes, I need Medicare because I don't have retiree coverage or I'm not a school teacher or whatever the situation is, if you need to buy your own product to supplement that 20%, this is where you need a really good agent to sit with you and walk through two paths, because you have two options. A lot of times people don't know that there are two options. There's a lot of material on TV. There's a lot of flyers, all those flyers in the mail and all that kind of stuff. It's typically focused on the Medicare Advantage side of things, which is that right side. But I'll walk you through kind of an overview and tell you why it's really important that you understand this is what you have. So your first option is you go get A and B of Medicare, which again is called Original Medicare. You keep that, and then you add to that a policy. So you come to JoAnne and you get a little policy from a carrier, an insurance company. I'm going to give you that policy, that plan, and the plan is designed just to pay your bills. That is truly what it's there for. You're going to pay a flat fee every month. I'll show you an example next, but you pay the flat fee every month, and then it just pays the rest of your bills. Your network is the entire country. So when you think of it, your base core, your primary insurance is original Medicare, and your supplementary product is with me called Medigap or supplement. You can call it either one, but all it's doing is paying your bills, right? So that means you can go to any doctor in the country that takes original Medicare, and then this little piece of the policy is going to pay the rest. We add a Part D plan to that person's world because you have to have a drug plan. You should have a drug plan for sure. If you don't, you get penalized as well. But the flip side to all of this stuff, that methodology, is something called Medicare Advantage. What Medicare Advantage is, this is from the U.S. handbook right here, what I'm reading off of here, but this is an all-in-one alternative to original Medicare. So people refer to them as these bundled plans. And what this means is you are no longer in the original Medicare system. You are really not enrolled in A and B of Medicare. What surprises people is they're not enrolled in A and B of Medicare. However, they are still paying premium to the government. So no matter what you do here, you're going to pay premium to the U.S. government for that Part B premium, always, unless you're on Medicaid. The only time people don't pay is when they're on Medicaid and Medicare together. So these bundled programs are just very different than original Medicare. The bundled plans have networks, they have co-pays, they've got co-insurance. You have to check to see if your doctor's in the network. You need to check and see if your medications are there, things like that. So they're just different. They work for some people, they don't work for other people. Some plans include, on the bottom it says lower out-of-pocket costs. Well, it's kind of a dumb thing to put there because who doesn't want lower out-of-pocket costs, right? So there's a kind of a slanting towards Medicare Advantage from the government perspective, and I will tell you why. It's because the government funds the Medicare Advantage plans. And I'm going to show you this example. Usually makes people really kind of understand what I'm talking about. Medicare Advantage on the right-hand side here, this is a zero premium plan in my backyard here. So we use this plan a lot when we need to for Medicare Advantage folks, but it's zero. It is literally zero every month. However, that person's still paying their $148 to the government, right? Now, the middle one is a Medigap plan. So this person pays $115 a month. They pay a higher amount. They still pay the $148 a month to the government, and then they pay $115 on top of that, where my Medicare Advantage plan does not. Well, look at the Medicare Advantage side. So they pay nothing every month. However, their max out of pocket's $5,300 after they incur potentially all those costs. If they're hospitalized for 2 days, they get a bill for $350 per day. They go to physical therapy 15 times. They pay $40 per visit, things like that. Note that there's there's dental coverage, which is cleanings built into those. There's a little vision club coverage, and then there's no drug plan premium thrown in there. So it's all a cart. It's pay-as-you-go insurance. Can work for some people, like I said, and doesn't work for other people. The middle column is Medigap. And Medigap is you pay that flat $115 a month to the insurance company. You do have a $200 deductible for the year, $203 this year. Everything after that deductible is paid for. So when I said you're buying this little plan to pay the bills, that's what you're doing. Your only obligation is to pay the annual deductible. Anywhere you want in the country, go to any doctor, but you will pay nothing. So if you go to physical therapy 16 times, you pay nothing. If you have chemo, radiation, those are really big charges. Typically, you pay nothing. You go in the hospital for 3 weeks, you pay nothing. Okay. You do not get dental. You do not get vision, and you have to add a drug plan. So it's separate. So it's phenomenal coverage. It's going to cost you more. So we kind of joke too, at the end of the day, here's what everybody wants. They want Medigap in the middle. They want that solid, good coverage, but they just want it to cost zero every month, like a Medicare Advantage plan. And that's pretty normal, things like that. The government, I'll just kind of readdress that piece. The government funds the Medicare Advantage plans because a lot of times we get people asking, well, how do they charge zero? The government, they pay $1,200, $1,300, $1,400 a month per enrollee to the insurance company that you signed up with. Okay, so that's how they get their money. That's why they add extra benefits. That's why they try and get people enrolled in those plans. Here's the downside, potentially, to Medicare Advantage. When you are brand new to Medicare Part B, so let's just go back to that GE person who's 68 years old, comes out and retires. That means that 68-year-old, my point is here, it's not always tied to age 65. So whenever the person starts Part B as in boy of Medicare, They have a 6-month window to go buy any Medigap plan that they want that's out there. Anybody. No medical underwriting is the key words. Okay. So a lot of people don't understand this, but if you have a health challenge as you approach Medicare, please be sure you're talking through both of these options, because some people, you will not be able to go get the Medigap policy after that. You have your 6-month window. So we have keep people all the time, rather frequently, unfortunately. I have cancer, I have lupus, I have this, I've got, HIV, whatever it is, we can, if we get them at the right, this is why, again, avoiding mistakes is so important. But as soon as they start Part B, they get the best coverage they can possibly get, and they can't be denied. If someone takes a Medicare Advantage plan for 3 years, for example, everything's fine at 65, they're healthy, they take one medication or nothing. 3 years later, they get a cancer diagnosis, they cannot get Medigap. Okay. So pre-existing conditions do happen in our world, and people are so not in tune to that. You're coming out of group insurance. You're just not, in not thinking like that, but it is a big deal for us. So that's why it's just really important to understand the two differences, number one, and then to choose properly, right? Because when you're 65, unfortunately, people don't get healthier usually at age 65 plus. So you just got to be careful, try and think long-term, try not to hyper-focus on dollars potentially, but that's how the programs work. Again, Medicare Advantage can be great, but we try and look down the road too. 75, are you going to be, what are you going to be like at 75 or 85? It's tough. We don't have a crystal ball either, but here's some positives from Medigap. It's control, it's you can go to any doctor anywhere, right? Budgeting, you just know your flat fee. You don't have to deal with the unexpected bills from maybe chemo or things like that. Snowbirds, we get a lot from Michigan going off to Florida. So we have people in Florida literally that get treated for all their doctoring up here in Michigan, but they live in Florida, and that it works. It works just fine. However, you got to be okay with higher premiums. I mean, it's not rocket science, right? There's no trick to it, if you will. It's going to cost you more, and it is just more solid coverage. Medicare Advantage is for people that maybe you can't afford it or don't want to afford it. There's a lot of people that are high net worth that don't want to afford that. They'd rather, save that $2,000 or $3,000 a year in premiums, and kind of roll the dice a little bit. And that's okay too. Under 65-year-olds, if they're on Social Security disability, that's where we typically will put a Medicare Advantage plan. There's veterans, there's special programs that get lots of perks with different plans too. So it's nice for them because they can come out of the VA system. So, you can start to see that everybody's pretty unique in this. So and then we got people that are just truly okay with networks. They really, really are. They don't care. They don't, if you tell me I got to go here and there, they just kind of live in their little habit trail and they're good to go. So there's a lot of people like that too. So I'm going to skip this because that pertains only to Michigan, but this is something called the donut hole. A lot of people know about it, and it just really freaks people out. And it's a pricing methodology Medicare has come up with that it basically means that if you take high expensive or high price medications, you're going to pay a lot for drugs. And that's another thing too, just to point out to you all that, like I said, with dental, this is for drugs. Unfortunately, if people take high price drugs, some of these are astronomical. Just, you've seen headlines probably. Insulin's always expensive, but some of these oral cancer drugs are just awful. So I don't have a solution for it. There really is no solution yet for those situations, but just you're going to be shocked probably with the price of medications when you get to the Medicare stage of your life. Okay. So just FYI, we do Part D plans all the time. These are the drug plans that you pair up with Medigap. Again, if you don't get one, you're going to get a penalty later. People always typically come back 5-6 years later. Oh, now I take meds and I need it. Well, now you got a big old penalty. And, worse, what if you get diagnosed in the middle of the year? Because you can't just go buy drug plans always when you want to. And if you get that diagnosis mid-year, it doesn't mean you can go buy a drug plan. And you might, your drug could retail for $500 a month and you're stuck without a drug plan. So it's not very smart to not get a Part D plan. And then if you do have Part D plans, check, because there's about 30 plans in every state, so you can save money in the fall potentially, or you can just catch the mistakes that might happen in January. Maybe your drug's not on the formulary, something like that. This is our timing of things with what we do all year. Basically, we work all year transitioning people, but this is our extra crazy time, October 15th to December 7th. That's when you see Joe Namath lighting up on the TV commercials and all that kind of garbage going. It's all induced to get you to make a phone call, truly. And a lot of it's to just get you into Medicare Advantage plan. Everything's free. You can see everything lighting up on TV. You get free done. You get free. Everything's free. I'll point out too the Joe Namath commercials and things like that, because people they're just amazed with what he's offering. He's offering that to people that are Medicaid and Medicare eligible. So if you're looking at that and if you pay $45 a month, then you just want to pay $0. If you're not on Medicaid, you're not going to get Joe's plan. So there's plans for you potentially, but just be careful. A lot of it's just marketing gizmos and stuff, and they just want you to call. And then next thing you know, you're calling a call center and they're calling you 18,000 times. So that's our kind of things. Medigap, we do every day of the year. Every month we can put people into new plans. In January, February, March, we just finished this enrollment period where people could actually leave, they could leave Medicare Advantage plans and go back to original Medicare. So I should point that out too. So people can all the time, and we do this a lot, is if we talk about this during the year, like right now we have lists of people that want to leave their Medicare Advantage plan in the fall because they didn't know Medigap existed and they like the sound of that. Well, they have to medically qualify. But we can do that. We can work with them to see if they get approved for a January 1st start date. So there's a whole bunch of just timing things all the time. So that's half the battle with Medicare. It's just, knowing the right thing to do at the right time. And then when do you start talking about it? Truly by 64 and a half. Don't do it too early, but don't do it too late, right? So, again, 64 and a half to me is a no-brainer because you can avoid mistakes. That's the only thing we're focused on, is avoiding mistakes. That's it. But when you have people at 61, 62, to me, that's too early. I mean, it's crazy thinking that if, Medicare, if they drop the eligibility age to 60, look how much can change that quickly. So don't go crazy, but prepare. We have a YouTube channel. You can just search Giardini Medicare on there. My son does our videos. He's one of our agents, and he does a really good job with just all the topics, everything. Our Medicare covering shingles, COBRA, how much does it cost? So all the things that I kind of hit on here, a lot more detail when you go through that. So you can take time there. That's what I love too, is, at the end of the day, when you get these self-learners, like I go to YouTube all the time for something I'm, Googling or YouTubing, right? You'll find tons of stuff out there. So those are good and helpful. Our website, we've got content built in there. And then how people deal with us or work with us is that schedule a free call button. So they just kind of pop up on the calendar. We don't charge for the consults. Again, if you're going to enroll in a plan, we want you to enroll with us so we can be the agent and help you, especially because we've, done all the work, the legwork of getting you there kind of thing. So that's about it. I'll just kind of end and put our contact information right there at the end. But I don't know, Maggie, if there's any questions. Like I said, I know there's a ton I throw at you, so it always feels like whoosh.
Yeah, that was a ton of information, a lot of things I had no idea about, but that's how it always is.
Yeah.
So some of these prices that you threw out of when you had the two Medicare plans, and the one is zero at the beginning of the year, but you have to pay for all these different things if you get them throughout the year. How often do those prices changes? Is this something that you have to be aware that it's really going to increase over time?
Good question. Yeah, good question. So every year, the plans in September, they come out with the new material showing every person enrolled in a Medicare Advantage plan and a Part D drug plan what's going to change for the new year. I will tell you, probably 98% of those people don't look at the plan documents at all. So, but it'll tell you, here's your new deductible. Here's your new, the fees are kind of hard sometimes to figure out. Like if you need a CAT scan, it's hard to always discern how much that's going to cost because there's this giant evidence of coverage. So that can be challenging, but your max out of pocket can change every year. Your plan can change your doctors can stop even participating mid-year. So that's what can get challenging. Yeah. So with Medicare Advantage, you just have to know you should, to have a good setup, plan on doing a little bit of homework with that. With Medigap, it just follows. So it's like, whatever, it still follows. Your bill's going to go up because it always goes up. But yeah, Medicare Advantage, you got to be aware of the changes, or you get snagged in January and guess what? It's too late.
Right. And so do any of these options or prices change if you then are married and only one of you gets Medicare at the time, or only one of you 65, or you both retired? Does anything change due to that?
No. So generally, no, there's no family kind of discount plan. The only thing that gets a little bit close is if you do Medigap, husband and wife both have a Medigap contract. There's some carriers have household discounts, but everything else is a la carte. So that's totally different too. Because you've been on group insurance for 40 years and you got a family plan. And now you're like, what do you mean it's all separate? So then you can have a husband on, a Medigap plan too. And I had this not too long ago where he had more health challenges. So he took Medigap and she was totally good with Medicare Advantage. So you can even get that, separate. So one of the worst things you can do is get the spouses that they think everything has to match. So they all need the same drug plans. It's like, well, you take different drugs than he does. And like, why, you might even pick 2 pharmacies that are different. It's so funny how everybody just gets matchy with some of this stuff. And like, no.
You think it's going to be easier, it's just like, just double it, but it's not.
It's not.
It's not quite the same.
No.
And so when you work with people, you can help them with their medical coverage, and then you help them get that dental coverage as well, right?
We'll give them, yeah. So that we do have, there's dental, vision, hearing plans that are just standalone plans that anybody can buy. Yeah. So we offer.
And then do you help people with that as well?
We do. Yep. We kind of give them the plans that we think and then give our 2 cents on the plans and the coverage and see if it'll work. But yeah, you can always add those on too. A lot of people, I will say, start out not buying a plan, and then lo and behold, it seems like they always come back at 67 years old, like, okay, my teeth are breaking down. Now I need something. So
it's been a couple of years without the dentist. I should probably go now.
Yeah. So now Now I got to go in next week. Can I have coverage? Sometimes yes, sometimes no. So it's kind of funny.
That's awesome.
Yeah.
And then where you work in almost every state, correct? So you can help people across the country, except I think just a handful of states, if I remember.
Right. We're in about 40, 41 states. Some of our I'll just tell the no states. It's probably easier. Connecticut, Maine, Vermont, Minnesota. Trying to think of our no's. We don't have many no's. So most of them are yeses. And we communicate. We're on the phone. So we do a lot of phone work. We just do a lot that schedule kind of thing, people popping up, that it keeps us all on pace. It's really nice because people upload some of their information. I'm turning 65 in September and I have this and I need help with this. And it's great because we come into the conversation, kind of know what we're talking about, and the people have time to gather questions and do all that. So it works really pretty well.
That's awesome.
Yeah.
And so it sounds like, people can just contact you and jump on your schedule if they're nearing 65 or just book if you're getting close, a couple months out, just put it on the calendar while you're thinking about it.
Right.
You can schedule and talk to JoAnne and she can help you get, prevent all the errors.
Yeah. Actually, so the one thing to point out is if you go to our scheduling page too, so statewide, not every agent of ours is licensed in every state. I tend to have the most states. So if you see your state listed, you can book with Trevor, you can book with Allie, you can book with, so because there's 8 of us, it's like, I do a lot of the talking and everybody thinks they have to be on my calendar and I can't handle everybody. So spread the love, please. But, or email. Email is great because I answer emails all the time, pretty much 24/7. So, feel free to ask questions and you don't have to work with us. Obviously, if you can or need to enroll and we can work in your state, we would love if you do, obviously. But you don't have to. There's no strings attached.
And then one of our last questions is, once you're enrolled, are you good to go? Or do you need to enroll every year or do you update or?
Yeah, another good question. Another really good question. So if you go Medigap, if you decide to take a Medigap contract, I would say make sure you get a good carrier. That's a lot of the battle, is picking a good carrier out the gate. You're going to have rate increases, so just kind of know they're going to happen. But let that thing roll over and over and over every year, just like a car insurance policy. Until you want to change it, let it just do its thing. All right, so let it go. Medicare Advantage, totally different. I would make sure you look at the material in the fall, and that is an annual. If you don't change something, you will be automatically re-enrolled, and that's fine for the most part. But if you want to be proactive and change, you're going to have to pay attention. But Medigap, you really don't have to pay as much attention other than the drug plans. That's a really good question.
Awesome. Awesome. Well, I think those are all the questions we have today. We appreciate all this great information, real succinct, which is great. Anyone can reach out to JoAnne at joanne@gmedicareteam.com. She's also one of our Purse Strings approved providers, so you can check her out on pursestrings.co on her page there. And reach out if you have any other questions pop up, because we are here to help you out.
Thanks, Meg.
Yeah.
Thank you. Thank you, JoAnne. Thank you, everyone.
You made it back. Thanks, Barb.
A little bit, yeah, just for a short window of time, I think. But yeah, this was great. The information's great. You do talk fast. There is a lot of information, but we do put together a 1 page or 2 that we'll put with your recorded video if people want to rewatch it, and they know how to contact you.
That's the value too of having the recorded. So I appreciate that you do that, because you can watch it 10 times if you need to, right? Or pause and rewind.
Yeah. What'd she say again?
Yeah.
It happens all the time.
Yeah.
Awesome. Well, thank you so much. And we'll be back here again next Monday for another Money Monday with Purse Strings at 1:30 Central. So we'll see everyone then. Thanks.
Bye, everyone.